Anyone paying attention to 21st century life in America won't be shocked by this, but the numbers are important. Adverse lifestyle trends counter improvements in cardiovascular risk factor management in coronary patients. We're talking about results from 3 EuroAspire cross-sectional surveys, and to do that, I'm talking to Dr. Kornelia Kotseva, a senior clinical research fellow at the Department of Cardiovascular Medicine, the National Heart and Lung Institute, the Imperial College of London, and more importantly for our purposes, you've been like the chair of the steering committee for Aspire and for the Health Economic Study and project manager of the Euro Action Plus. Now, EuroAspire is something that is fascinating. We've gotten a lot of information over the years from these various surveys. Tell us a little about EuroAspire before we talk about the JACC paper.
Well, it's important to understand that EuroAspire is a series of surveys which they were designed to audit the implementation of the European guidelines on cardiovascular disease prevention in everyday clinical practice. So when the first European guidelines on coronary heart disease prevention were published in 1994, in 1995-96, the European Society of Cardiology carried out the first EuroAspire survey in coronary patients in 9 European countries. The results were quite disappointing, showing a gap between the guidelines and their implementation in the clinical practice. So since then, the guidelines were updated another 4 times, and now the most recent guidelines were published in 2012. And in between the guidelines, we carried out 3 more EuroAspire surveys with the objective to see how the guidelines were implemented in everyday clinical practice and whether the practice preventive cardiology improved by comparison with the previous surveys.
Now, in the JACC of October 6, 2015, you have a paper in there that's fascinating. What I really like is your idea of looking at the trends across the 4 surveys. What gave you the idea to do this analysis in the first place?
Well, this is one of the objectives of EuroAspire surveys, to see whether the practice of preventive cardiology has been improving during the time since the first survey. So we already always, when we have EuroAspire survey, we compare with the previous. And the comparison between EuroAspire 1 and 2 was published in the Lancet, 1, 2, and 3 again in the Lancet. And now the comparison between 2, 3, and 4 will be published in the JACC.
So what did you find? I mean, what were you expected to find? What did you actually find?
Well, this is a very usual question where we are presenting at the congresses and where we are planning for the next EuroAspire. And I always answer that we hope that the practice will be improved by comparison with the previous surveys. Unfortunately, this didn't happen so far. Especially in terms of lifestyle. What is interesting in our most recent paper comparing 2, 3, and 4 is that there is no change in the prevalence of smoking between these 3 surveys, and there was significantly increase of obesity, essential obesity in Europe. In those countries which participated in the survey, and this probably led to the increase of the diabetes.
So 21st century lifestyle is really working against everything that we've done to improve cardiology over the course of the last few years.
Yes, I think it's very important, the lifestyle changes, because the other results that we have from EuroAspire in terms of management of blood pressure and lipids, and especially the use of cardioprotective medication, the comparison shows that there is increase in the prescription of medications between first and second survey, but then the last two surveys, there is no more increase in the prescription of medications. So probably we hit the ceiling of prescription, and we have to focus more on the lifestyle intervention.
So what can we do to improve preventive cardiology as it's practiced in the 21st century?
We have to invest in prevention. We need specially designed preventive cardiology program, which are multidisciplinary and comprehensive. They with different healthcare professionals, and also we need a healthcare system which invests in prevention, because to save the acutely damaged myocardium is not enough.
Yeah, absolutely. Well, thank you very much, because this is a fascinating look at a nice span of time, 4 different surveys, and it is coming up in JACC, and it is in the October 6, 2015 issue of the Journal of the American College of Cardiology. For CardioSource World News, I'm Executive Editor Rick McGuire.